very close attention to them.
So this next question is going to kind of ask you to use your magic 8 ball. So the question is, when do you expect that rates of new cases will start to fall off? So that question can also be, when do you think the surge is going to happen?
Right. So that's an excellent question, and you're right, it does take a crystal ball, and those predictions are changing, if not every day, at least every week. I was on a call last week with all the CEOs up and down the county, or up and down the San Joaquin Valley, from Kern County all the way to Merced County, and we were hearing that the predictive models that they were using at the time were suggesting that we were going to really start to see the beginning of the surge. It would start in the Bay Area, then it'd move quickly to Southern California, and they were actually projecting that it would start this last weekend. But because of, I think, the measures that California took very early with respect to social distancing, sheltering in place, closing down so many different venues where people gather, that it actually has had the effect of flattening the curve. So they now pushed that beginning of the surge to mid-April. So that's the beginning, not the apex. And then because of the San Joaquin Valley being less densely populated than these other areas, predicting that we were probably 1 to 2 weeks behind the Bay Area and Southern California, so that it was more likely that we would be beginning to see the local surge here at the end of the month or the 1st of May. The governor actually stated recently that he's predicting that we will see the apex in California around mid-May. Now that all said, and I think this is one of the things that's very frustrating to us in healthcare and trying to plan for the unknown, there is a highly reputed, highly endorsed predictive analytical tool called COVID-19 Qventus. And I think anybody can go online and look at it. And you can actually plug into it specific regions to see what the models are predicting for that particular region. So we've been looking at this tool over the last few days, and for whatever reason, Tulare County is joined with Kern County in defining what our particular South Valley region is. The population of the two counties, Kern and Tulare, is 1.4 million. And so what their model is showing is that for that particular region, Kern and Tulare County, that the surge will begin around the 1st of May, but that it would not peak until mid-July, which is very disconcerting because obviously that's 3 months from now. And the thought of sustaining the effort that has been going on for this last month for 3 more months until we hit the apex, you start losing a bit of your optimism at that point. But so that's again the frustrating part is we don't know exactly when that's going to happen. We do hear that the outbreak, the rate of new cases on the East Coast appears to be declining. The mortality rate appears to be declining. I think Governor Cuomo is suggesting that they might be reaching a plateau, which is great news. But just I'm hoping that California and the San Joaquin Valley in particular, that it would be a much different experience that we have here than what they've had in other places of the country.